Okay, so for Jordan, we're going to try to determine whether he has potentially a TFCC tear or a distal radioulnar joint sprain. So what I'm going to do is a axial compression with ulnar deviation of the wrist, turning it into pronation and supination with the axial load to see if there's any pain or clicking in the TFCC. So I'm going to test his injured hand, which is his left hand. I'm going to apply, just relax your arm, good. I'm going to apply an axial load on the TFCC. First, ulnar deviate, apply an axial load, and I'm going to rotate between pronation and supination. Any pain or do you feel clicking at all with that?
Not really, no.
Good, and I don't feel any clicking underneath my finger. So this test is negative for TFCC tear or sprain. The next one I'm going to do is just use joint play to determine the amount of laxity. If there's any excess laxity, could indicate a potential sprain in the distal radioulnar ligaments. So what I'm going to do, I'm going to palpate. I'll do the non-injured hand first, so I'll test out his right arm. And I'm just going to palpate the edge of the ulna and the radius. I'm just going to do joint play between the two. So just pushing anteriorly on the radius and pushing posteriorly anteriorly on the ulna. Rotating between the two. Not very much laxity for an end feel. And now I'm going to test the injured hand first. Same thing, I'm going to palpate the ulna, moving up to the radius, just testing joint play between the two. Rotating between the two. Equal laxity compared to both wrists. Was there any pain with that?
No.
Good. So it's negative for a distal radioulnar joint pathology.